walking stock past my house. The thing with school playground, my kids are at the same school. Like, the dog for a chat job, right? But yeah, it's fantastic. What more we need going? And I'll also have one. Do you want us to say a quick word about what you guys do? It's supporting everything we do. So
I've been volunteered.
oh, there's what we're doing.
So I'm Amit, I'm a solicitor at the patent and trademark firm. We file patents, register trademarks, but we also provide commercial advice and strategic advice for early stage companies as they progress in their stories. So for companies like this, and what we hear at O2H is just so interesting to us, and yeah, why we keep filtering.
Okay, thank you. My friend said to her, "Is that? You know, are you in sales and marketing to see you?" She's like, "No, I'm actually a citizen." So I'm like, all right, okay.
Thanks, everyone, and thanks for all your support throughout the years. So really, really appreciate that. On this slide, I think for today's talk, I think everybody agrees with me with the statement that selecting the right drug target, the biochemical entity developing a drug against, is the key to the success of a drug discovery program. When you get the target right, you can revolutionize treatment options for the patient, but when you get it wrong, next slide, please. It can cost a lot of money. With some sessions talking literally hundreds of millions when they're in the clinic. So the key reason why we get target selection wrong is that we underestimate the complexity of biology. So we take something like E. coli, one of the most studied organisms. There have people been looking at E. coli for over 100 years. It's got something like 4,000 genes, produces like 10.7 million different RNA species, over 132 million proteins, and huge amounts of metabolites. It all fits in a volume of 0.7 micrometers cubed. As we know, it's not a bag of jelly, it's highly organized, complex structure, and dynamic structure. So what I'm trying to say with this slide is, with something like even E. coli, we're vaguely, we're touching, understanding the biology of this organism. So we've got a lot to learn. Next slide, please. So there are a lot of companies out there that do target ID. I've done a very simplified version. So what they tend to be is what I call statistical modeling. So what do I mean by that? So they'll start off with a disease state. They'll use big data, genomics, transcriptomics, use some machine learning algorithms to find associations, and you come up with a putative target, and they'll go towards drugging that target. What we're saying is, next slide, please. We're saying that putative target may not be the best one to drug. You need to look at that in the context of the biochemical network that it's part of. And what we do is that we carve out part of the network and build a detailed dynamic mechanistic model of that network. Thanks. So we've got this mechanistic modeling platform, which we've got from it. So the input parameters that go into that modeling of that network include things like transcription translation rates, fertility rates, half-lives, regulatory mechanisms, enzyme concentration. So those are some of the input parameters that go into our modeling. And that allows us to run simulations in intelligent targets. So we can understand things like bypass mechanisms. So when bypass mechanisms, if we go after a particular target, understand the sensitivity of those targets. Do we need to hit it hard? And using this platform, we've also discovered new regulatory mechanisms as well. You get to the next slide. So, I mean, the analogy I use is statistical map modeling can be seen as like a paper map. It's one-dimensional static low resolution. What we're trying to do with our dynamic mechanistic modeling is produce a Google map. So it's a high resolution. You get a lot of more information. It's dynamic as well. So what we're trying to do is build dynamic maps, Google maps of biochemical networks. So next slide. So we initially focused on modeling bacteria, the E. coli K12 strain. And the reason for that is, as I'm sure everybody in this room is well aware, there's a big antibacterial resistance crisis. And these numbers given here are mostly underestimated. And what I find really startling is that there's been no new class of antibiotics to treat gram-negative infections for over 50 years. And we think that's partially down to incorrect target selection. It's the next slide. So this animation shows an example of our model in action. So this represents an E. coli cell, and an ops represents enzymes, substrates, and metabolites involved in making pseudoglycan a component of the wall. In a minute, they'll start dancing, and that's the reaction taking place. And those CC form that the pseudoglycan enzymes, they form and get floated into that nucleus space. So you can imagine what we can do with this model. We can push down different parts of the network and see what impact it has in this case on pseudoglycan biosynthesis and testing in the wet lab as well. To the next slide. So tissue can be divided into gram-positive and gram-negative. Gram-negative have this extra outer wall, which makes treating them really challenging. So what we did was we modelled this outer wall using this platform, so specifically the LPS. It's the next slide. You can see the animation. You can see the modelling animation again. So this time, the dots represents enzyme substrate metabolites involved in making lipid A, which is a component of LPS, and it's the red dots basically. That's lipid A. Here we stripped away everything. You can see the lipid A being made. And then we can interrogate different enzymes along that pathway. And here we've looked at a particular enzyme, which you can see as you get into it, the red dots get lower, the elliptic further get lower again. This is all sort of wet lab data to validate the target. So we've identified a target using this method. Exactly this time. And then we did went for a clocking study against this particular target. There were still structures available for this target. And cut long story short, we identified 5 hits. And then we based on the data we generated, we won a biomedical catalyst grant. And the grant will allow us to move this program in vivo. Good to decide. So we've started the hits and lead work. And what we've shown is basically we're getting just a little bit of we're getting activities, MIC activities with the compounds against gram-negative strains, which are below 10 micrograms per mil. So these are key gram-negative pathogens, and the testing we do are against drug-resistant isolates, and we've got activity again. We've got MICs below 10 against all these key pathogens. I think having them below 10 indicates that we're in the right place. There's some in vivo data as well. Next slide. So we've also we all know that the antibacterial markets are challenging maybe to be. So we've also been working with groups to apply our modelling to mechanistic modelling to oncology pathways. Next slide. I'll just touch on this very briefly. So we're working with Simon Cook, he's director of the Babraham Institute, and he's been working on the MAP kinase network for a long time. So we worked with him to model this work with over 90 components in the modelling. We identified a target. We've got some early stage active compounds against this target now. And we've also been working with Francis Pearl over at the University of Sussex. Here we've been looking at synthetic lethality targets, and again, to cut a long story short, we've identified some pairs of synthetic lethality targets, and now we're going to be working towards drugging those as well. So we've got a great team. It's a terrible force. Jeez.
Yeah, the girls are trying to find the worst picture of all of us out there.
So my background is worked in various roles in business development and licensing. Also worked for a couple of VCs as well. John is my co-founder. He's the brains behind the modelling work. So he's a traditional old school biochemist. Tony's our med chem. He's been in the med chem industry for a long time, in pharma and biotech, and he's taken several compounds from discovery into the clinic. Ed's our microbiologist, so he does all the microbiology testing that we do. Rui's our computational biologist, so he does a lot of the modelling work, but also has a lot of wet lab experience as well. And we've got Tim that helps us keep the cash flow moving most of the time. So thanks. So to summarise, we're looking for a 200k equity investment, and that is to match fund the Innovate UK grant. As I've described, we've got an amazing team that's delivered. We've established this platform to identify targets, and we've shown it works by modelling bacteria. So we've gone from a platform, first-in-class target molecules, and we're very close to getting some in vivo data. As I've mentioned, we've got this Innovate grant to move into in vivo. We've been applying the platform to oncology pathways, and as I mentioned, we've identified targets, and we've got a program that's almost ready to go to in vivo. And to add, we've generated around 500k from service partnerships, screening and modelling work. That includes the top 10 pharma. That's it. Thank you very much. Sorry.
Features against the NDMs.
Yes, we have. It does work, yeah.
That's right. Yes, that's what.
So look, we've got you know Ed, so Ed he works alongside us, and we've got a whole range of isolates that he helped from the last CRO. Of course, yeah.
Okay, can you tell us a little bit about the sort of story of like, you know, funding is hard, and then you've had to like pivot to sort of a revenue generating model, which you've done. So maybe a little bit about that now where you are.
Yeah, I mean,
Just to show what stalled. No, you don't get what you have to go through to.
no, it's been very painful. There are easy ways to make money. Drug discovery in antibacterial resistance. You know, I guess our sweet spot when we started was, well, John, he worked on the outer envelope of gram-negative bacteria, so that's where our knowledge was. So that's why we focused on that. And then when Ed came in, he was very passionate about antibiotic works. He came in as well. So as we know, antibiotics is a very challenging commercial place to be in. Most companies have most of the investors and a lot of the farmers have dropped out as well. We said that there are still groups of farmers that we're in touch with, you know, the MSD, Roche, Shionogi, Debbia Farm. So we've established relationships with all those guys. But with investors, it's a very small pool. So we've had to really be creative. So we have grants, we've had to do service work, and we've got, you know, so luckily we had a partnership with a large pharma around modelling, so that's brought in money. So it's been it's not been an easy ride.
So now you sort of pivoted to the sexy oncology targets, in other words.
Yeah.
How are you finding that now?
I mean, it's night and day when we go to investors with the oncology project. So they actually want to meet with us. So which is so yeah. So it's a question of how we position that as well. So
yeah, I mean, the whole antibiotic space, and it's been very challenging for investors to make any money, and so most investors have sort of steered away from it. But now that pivotal's been done, I think it makes it more interesting for venture capital investors to come in. I think that, you know, the 200k will ramp up quite quickly. I think from some conversation. So anyway, thank you very much for the pitching.